the health of the ovarian reserve. Can somebody do, or is there anything you can do to sort of preserve your ovarian reserve for a longer amount of time? Or
well, that's a great question, and there's a lot of people working on that at this point. To try to improve our reproductive longevity, especially for women. And we don't really have a clear answer on that at this point, but we do know that a healthy lifestyle, specifically that's low in endocrine or ovarian endocrine disruptors or ovarian toxins, can certainly be beneficial. We always say the avoidance of a lot of processed foods, endocrine disruptors, any kind of overexposure to free radicals is probably beneficial. Unfortunately, it's not always practical to live your life that way because a lot of those, chemicals and exposures are essentially ubiquitous in modern life. So do as much as you can. However, the most of those variables are predetermined through genetics, or we call epigenetics, how the genes are then expressed. You can modify a little bit the second component, but the first component at this point, we can't really modify, or we don't know how to adjust it too well at this point. So in summary, I think a healthy lifestyle that mitigates a lot of the modern issues is probably the best advice I can give you at this point. And if somebody is, not ready for a family, but desires a family in the future, asking a medical professional or a reproductive endocrinologist about fertility preservation is certainly an option.